My client, Abby, in standing, when you look at her sideways, you see increased tone in the sternocleidomastoid muscles. And maybe the camera angle, maybe it captures that as well. And when I come and I palpate that muscle as well, coming under the mastoid, I feel increased tone in that muscle. And the sulcus, the coming under the curve of the mastoid is shallow. I quickly hit the bump of your first vertebrae called the atlas, or C1. And that happens when the atlas is stuck in extension, when it's stuck forward. And when I try and spring it to the right, there's no movement. And I'm trying to spring it to the left, and there's ever so little movement. But if we come below that, C2 moves nicely. Okay? When I spring the mastoid left and right, it moves well. And when I side bend the mastoid on either side, that moves well. When I come underneath, okay, the big bump below the occiput is C2, and I can lift up and easily get movement. But when I come up just below the mastoid, just below the occiput, and I try to lift up on C1, with the same amount of force, there's no movement. Okay, same thing when I try and lift your head feels very heavy because that first joint is stuck. So it's as though you stuck your chin forward and it stayed that way. Okay, and what we note is that when I try and do traction and I put the force here, it has to be because these upper two joints are in the front of the neck, all the other facet joints are on the back of the neck. When I test upper cervical traction, I have to be on the temples, okay? So when I try and traction you, there's no give with a reasonable amount of force. It's very rigid. Normally, you would see the traction movement, and I would see it move all the way through your body down to your feet. I would see your feet bob up and down. We tested you a little while ago, and when I lifted the head of the table up and put you in flexion, about 10 degrees of flexion, we then had free mobility. Okay, so that's a clue. It tells us that we want to treat it in flexion. And what I'll do is I'll put you only in about 5 degrees of flexion for the treatment, and then I'll contact the temples again. I'm showing a lower contact, but I'll be up higher up. I'll contact on the temples, and then I'll do a slight traction, and I can see movement. I can see that I can create movement. I see your feet move, and I'll hold this for 2 minutes. Okay? Mm-hmm. And you can treat yourself, putting your neck on a pillow and putting your hands on the side of your head and just pushing up towards the crown of your head. Okay? And the other thing is that when I drop the table back, and I did that a while ago, so her neck was in extension, she was also very stuck. Okay? So we call this a hyperextended Atlantoaxial joints. It's the C1, C2, the number 1 and number 2 vertebrae at the top of your neck are stuck forward in extension. Okay? I have a book chapter on this coming out in a book called Human Motion, coming out in February 2020. Okay. So I'm going to stop filming now, and I'll put you in 5 degrees of flexion. I'll do very gentle traction. Mm-hmm. I'll refer you to exercises in a neck cradle on YouTube. If you search my name, Hesch, H-E-S like Sam, C-H, upper cervical exercises. It's in a neck cradle developed by Dr. Reiter, called Dr. Reiter's Real Ease, R-I-T-E-R-S. And that device isolates movement to the upper cervical spine, so it's really easy for you to self-treat this. Okay. So my hands-on treatment is once, it's 2 minutes, and after that we teach you how to keep this motion. All right? Okay. So I'll stop filming and I'll treat you, and then we'll film the response to it.